She started complaining a lot of pain in her belly. At that time, we used to live in North Carolina. So we took her over there to the emergency room, and they were doing a lot of studies on her, and they didn't find anything. So I go, we're gonna do a deeper test on her. So they did. They went deeply. So they go to me, and they go to me, you're sorry to tell you this, but your daughter has leukemia, AML. And then I call my husband, and I go, babe, there's something wrong with Leslie. She goes, what? He goes by himself. He goes, what does she have? She has cancer. She goes, what do you mean cancer? I said, yeah, cancer.
I met Leslie in June of last year. She and her family were relocating back down from North Carolina to South Florida. And they had just been told that Leslie had AML. It's a form of leukemia. AML is considered a more difficult form of leukemia to cure, but it is a curable condition.
Arriving here at Miami Children's Hospital, I knew we were in good hands because one of the doctors goes to me, I'm gonna send you to the best hospital back there in Winston-Salem. And she goes, they're gonna help her do better.
With the treatment, the patients become extremely immunosuppressed and their bodies are susceptible to aggressive forms of infection. So if you were to choose a children's hospital, you'd want to choose one that has very good intensivists, very good subspecialists for support, which we have down here, and we have very good outcomes from our pediatric ICU.
The first chemo, when she did her first chemo, that's when the hair started loosening, falling apart. Like I will brush it, and I will see these chunks of hair. And I'm here crying, Mommy, are you okay? Yeah, Mommy, I'm fine. I'm just tangling your hair. But what's wrong is my hair falling off already. And I'm here, yeah, Mommy. You don't want to see your kid going through that. So I go, okay, Mommy, do you want me to shave my hair also? She goes, no, Mommy, you're going to look ugly.
When Leslie came down and needed help understanding her disease, we had great people from Child Life to come and meet with her, and they can really spend a lot more time with the kids than we could by ourselves.
My job as a Child Life specialist is to provide the support that the patients and families need while they're here in the hospital, whether that be education about any procedures or diagnoses that they may have, helping them understand why they're here and answering any questions that they may have.
The Child Life specialists, they just take their time just making the kids feel better. Like whatever they want, they get it. If Leslie wants a pink horse, they go get a pink horse for her. It doesn't matter what they ask, they get it for them. It makes me feel better because you see your child, even though they have the sickness, they don't think about it because they keep their mind entertained.
I met Leslie about 6 months ago when I became the specialist on 3 North. And I remember coming into the room, and she just greeted me with this big smile, and she was very happy to see someone ready to help her.
The Child Life specialist helped me overcome my fears by showing me how the port was going to work and how everything they were going to put in my body was like.
For Leslie, we used an education doll for her because we knew that she was going to be getting a port, and the doll that we have has a port in it so we can explain exactly what she's going to be getting and telling her how she's going to be getting her medicine through her port.
We have Child Life that is very helpful in helping the kids get through something in an age-appropriate way. They're very useful in helping a family cope with what's going on with their diagnosis, and I think that they were really helpful with Leslie.
When we heard the news, when she goes, well, you guys are ready to go home. It was 2 days before Thanksgiving. Can you imagine Thanksgiving with your daughter? She almost died too, like 3 weeks before. It's an amazing feeling.
When I come into work at the hospital, I do not feel like I'm coming to work. I wake up every morning and I'm excited to come here because I know that I'm making a difference for these patients and their families. And being able to help them every single day is the best gift that I could ever be given.
I'm strong and I'm really happy to be better, and play with my friends and be in school.
She's back to normal. She's been doing very good. Just being in the hospital for 6 months or having the treatment, seeing your kid back to normal. Here I go again.